The following program on PBS 39 is made possible in part by
The Eye Center of Fort Wayne is devoted to eye care. Dr. Rex Parent, along with medical optometrists James French, Paul Gill, and Gregory Zink, specialize in medical and surgical eye care. For refractive treatment, the Eye Center of Fort Wayne utilizes technology such as Bausch & Lomb custom LASIK and multifocal refractive lens exchange. More information is available at 424-5656 or drparent.com.
And good evening to you. Thank you so much for watching PBS 39's HealthLine here on PBS 39 HD. I'm your host, Mark Evans. It's been a few weeks since I've been here at the HealthLine desk. I'm recuperating and recovering from major back surgery, and I hope to have a show on that coming up in the next few weeks or so, and also feature the surgeon who practically saved my life. But tonight we're talking about vision care, and one of my favorite special guests back on the panel tonight at the HealthLine desk, Dr. J. Rex Parent, ophthalmologist for more than 25 years here in the Fort Wayne area.
That's correct.
The very interesting thing about you is that you started out in emergency medicine and eventually went into ophthalmology.
That's right.
Why the passion for the eyes?
Actually, it's a thrill. The individual, Dr. Rothberg, who used to be in town, is the individual that kind of talked me into this. And being in his office, at that time we didn't do all the fancy things we did now, but he could take people that couldn't see, and in a few days they'd see. They did have to wear thick glasses or contacts at the time, but to see that work and to make that people happy by making them see better was a real thrill for me. And he pretty much kind of talked me into this business.
Well, we have a very interesting show lined up, as we always do with you, Dr. Parent. We're going to invite our callers to give us a ring anytime in the next half an hour. We don't stop down for any commercials. It's a constant 1/2 hour program dedicated to you, the viewer. 969-2720, or long distance for our many out-of-town friends, 866-969-2720. Our topic tonight, refractive options. And we've talked about these things before with Dr. Parent, refractive lens exchange. Also might even delve into some LASIK surgery procedures tonight and talk about the differences, and like to really tackle refractive lens exchange and the options. Can you explain exactly what that is? And before you do that, I do have a side note. Dr. Parent implanted the United States' first multifocal lens during the original array lens FDA study. And how many years ago was that?
Well, that's been almost 18 years.
Okay.
And there was a group of us that did that across the United States, and it really sold me on helping people. What a multifocal lens is, it allows people to see at distance and near after cataract surgery. And the real disadvantage to that lens is the fact that you have to pay out of your pocket. No insurance company, they don't care if you wear glasses, and no, the government won't help you with that. So certain people, though, who really don't want to wear glasses and feel that they absolutely want to be less glasses dependent, opt for this multifocal lens option. But reality, just as we talked right before we went on, the reality is cataract surgery has become refractive surgery. And the reason it's become refractive surgery is we have the ability to reduce people's need for glasses even if they don't get the multifocal lens. We try to make them less dependent on glasses when they have their cataract removed than they did before. And some people, one lady that I operated on today, to give you the difference in lenses, one lens I put in today was 27.5, which is a far-sighted person, and one person I put in today was a 7.5. So it was 20 diopters difference in power. And when I used to do humanitarian work, and when we first did intraocular lens surgery, we put about the same power in everybody, and then they just wore the same lenses after. Because we didn't know how to calculate it real well. But today we have all these different ways to calculate things, and that's just part of refractive surgery and part of the progression of cataract surgery.
When we talk about refractive, or call it refractive surgery or lens exchange, exactly what do we mean?
Well, refractive surgery just means attempting to reduce your need for glasses. It might be reading glasses, it might be distance glasses, it might be both. That would be a multifocal lens. It might just be reduce your need for contacts. And refractive surgery never has a 100% guarantee. You always have a small margin where, you are improved, but it may not be absolutely as perfect as you think. But we're at the point where we're very close to making most people see 20/20 without glasses.
Very good.
And part of that's LASIK, as you mentioned before, advanced surface ablation, where we actually can change the cornea shape. And even there are intraocular lenses you can put in eyes that already have your regular lens in your eye. That's not as popular an option because in certain people they can get a cataract or they might get glaucoma from it. It's not quite as popular an option, and it's only used in people you can't do LASIK or something on the surface of the eye.
Mm-hmm. Let's talk about the surgical procedure. And, thinking about this type of operation on the eye, I mean, you would assume that, oh my gosh, what a major ordeal. But we've even had guests, some of your patients, come on and talk about how really, in the scheme of things, how simple this really was and how they were so impressed with the recovery and the speed of recovery. Let's talk about the surgical procedure, and we'll go to Rick on line 1 in just a couple of moments.
Well, the surgical procedure is well advanced from what it used to be. We actually use no stitches. We go through an incision so small, in not every case, but 99-point-something%, we don't use any sutures. It's an incision so small that it actually closes on its own. And when we do this procedure, we use an ultrasound, and we actually vibrate the lens into tiny particles, remove it with aspiration, and then we place the lens right back in the original capsule. The picture you're seeing now is actually of LASIK, and sometimes with LASIK we will actually do that on top of a cataract where people say, you know, I'd like to be less nearsighted or less farsighted, and we usually do that after the surgery. But with cataract surgery, we do it through a small incision. It's so small, and we actually don't go through blood vessels. So many of my people are on Coumadin or have health issues, and literally what I tell them is if you can take a sleeping pill at night, you can have your cataract surgery. And if they do have health issues, of course, we clear it with their doctor. But
All right, let's go to line 1 with Rick, and then we'll talk about the intraocular implants that you're very familiar with. Line 1 with Rick. Hello, Rick. Thank you for watching HealthLine tonight and for calling. Your question for Dr. Parent?
Hi. I have a couple questions.
Okay, go right ahead.
I'm over 50, and I'm kind of relying more and more on my reading glasses. I do wear bifocals at work. Do you have like a consultation to see if I'm a candidate?
Yes.
LASIK?
Yes, we actually do. We have people come in and we consult with them essentially for free, and to see if they're a candidate, because there's no sense wasting your money if you're not a candidate. And people that call the office can come in, but there are certain restrictions. If you have a lot of astigmatism, sometimes it can't be helped. But people over 50, most people over 50, and essentially all the girls in my office who've had surgery of this type have had multifocal lenses put in their eye, and that's what we were talking about earlier. And it's not 100% guarantee, but in 90-some% of the people, it just absolutely reduces your need for glasses at distance and near. And what you're talking about, Rick, is the fact that you say, yeah, I'm becoming more dependent on my glasses.
Yeah, like in front of the computer. You know
absolutely.
I mean? It's really getting hard to read without them.
Absolutely. And that's not uncommon. But some people, even though they have all these procedures done, still prefer to wear like computer glasses, because at that exact distance sometimes they say, well, if I lean forward I can see it, or if I lean back a little I can see it, but I like to sit right here. So some people still wear computer glasses. It's rare, but they do. And the girl that actually schedules all my surgeries, and she scheduled thousands of surgeries, at 36 years old elected to have the multifocal lenses because she saw those people could see at distance and near well, and they were about our happiest patients because it's essentially a lifetime fix. And the other thing is, you do not get a cataract. So it takes away that problem down the road. It's removing your lens, which when the lens becomes cloudy is a cataract, and therefore those people really are much less dependent on glasses indefinitely.
And Rick,
go ahead. I have average, I guess. I don't know. It's not super great, but it's not real bad. Healthcare insurance. How much insurance plays in a role of something like this?
Well, most insurance for refractive surgery pays nothing. If you would have a cataract, they'll pay. But as I mentioned before, insurances are happy to help you if you have a cataract and you need to see better. But if you want to see better without glasses, they really don't care about that. And all these companies that have spent millions of dollars getting these special lenses approved don't give them away for free. So that some insurances have paid, and the girls have been, my girls that collect insurance have been surprised over that. So a very few insurances have, but most won't pay for the refractive surgery lens. So for that special multifocal lens, most insurances don't pay for that.
What you're saying is my sight long distance is starting to get a little blurry without the bifocals that I have to wear at work, and the up close, I'm starting to even fill my truck up with gas.
Yeah.
I'm having to put the reading glasses on. You can help that then?
Yes, it helps that. There's no guarantee of anything in life, first of all, but in most surgeries, but you have over a 99% chance of significant improvement. And as I say, most girls in my office that have had me do surgery on them have elected to have the multifocal lens put in their eye because they feel like it's a lifetime fix. And exactly what you're talking about, Rick, it not only fixes you at distance, but it helps you at near, where you can see much better at near for most of your life.
All right. Rick, thank you so much for calling, and best of luck with your vision situation. The telephone number is 969-2720, local or long distance, 1-866-969-2720. We still have quite a few minutes left in the program to ask Dr. J. Rex Parent, ophthalmologist, any questions about eye concerns. Let's go to line 2 with Steve. Steve, thank you for calling. Your question, please.
Yes, this summer I had a heart attack, and that got me put on to Plavix. And the thing I'm having is I know a side effect of Plavix is cloudy vision, and I'm really having that severe. Is there anything that I can do about that? I do have cataracts, but not bad.
Well, Steve, what I tell you is that the Plavix visual clouding is rare. And if you have an eye doctor or somebody who takes care of your eyes, in most cases, if you're on Plavix and you have cloudy vision, it's something else. The only one thing you can get with Plavix, you can get some bleeding in the retina, but it's rare. Usually you have petechia or bleeding on your skin or other places in your body. So I don't think the Plavix, immediately going on Plavix in most cases, would not cause your vision to get blurry. So if you feel your vision is progressively getting blurry, I doubt if it's the Plavix. And if it were me and I was in that situation, I'd check with your eye doctor and have them take a look and look inside your eye and dilate your eye and see if they find another cause. The most common cause of clouding of vision that becomes more and more progressive, if you've had a little cataract, would be progression of the cataract. So I'd have your eye doctor take a look and have them see what they think, and if you'd like us to take a look, that's up to you, but certainly somebody who's seen you in the past could grade whether your cataracts have progressed, could look at your retina and see if there's any change in your retina.
All right, Steve, thank you.